Hi, my name's Lauren. I'm a respiratory physiotherapist at the Royal Free Hospital, and I've got my colleague Abigail with me today, who is going to help me to demonstrate some breathing exercises for you. Thanks, Abby. I'm going to give you some advice and instructions on how to use a breathing exercise called the active cycle of breathing technique. And this is a series of exercises that I'm going to talk through in the individual components, but when they're all put together will help you with managing your breathlessness, but more importantly give you a really effective way of clearing secretions without becoming too fatigued or wheezy. So the first part of the active cycle of breathing techniques is what we describe as breathing control. And the importance of breathing control is, as the name suggests, it will help you to feel a little bit more in control of your breathing, but also allow you throughout the exercise process to have some time to rest and recover, and that will in turn prevent you from feeling too fatigued at the end of doing your exercises. And the important things to really help with breathing control are the position that you're in when you're doing it. So I've put a couple of pillows behind Abby's head and shoulders, and that will allow her to be able to really relax her neck and allow her shoulders to drop so that she can hopefully use the muscles in her upper chest as sparingly as possible. So you'll see that Abby's upper chest is nice and still, and what I'm going to encourage you to do, Abby, is think about the air flowing in and out of your chest, but your shoulders remaining relaxed and comfortable, and let your shoulder blades sink into the pillows. And if you can, breathe in and out through your nose. Now, I appreciate that sometimes when you're feeling very breathless, that isn't always possible, and it may be that you can breathe in through your nose and out through your mouth, or if you need to breathe through your mouth, then do whatever feels most calm and most comfortable. But if you can reduce the amount of work in your upper chest, that gives you a little bit more energy. Good. And it may help, some people find, to pop your hand just resting lightly on your belly so that you can just feel a gentle rise and fall of your belly, and that means that you're using your lower chest to breathe and using your upper chest a little bit less. And if you can, try to slow your breathing down, although that's not always possible. And what I usually advise is that when you're feeling well and you're not breathless, it's a really good idea to practice breathing control, because it's about building good habits with your breathing. And if you do that when you're well, you might find that easier to reproduce when you're feeling a little bit more breathless. So the next part of the active cycle of breathing technique is deep breathing exercises. The same thing will apply. Try to keep your upper chest as relaxed as possible. Think about the air going deep into your lungs rather than it be a big breath. So as you breathe in, avoid breathing up into your shoulders and breathe down into the waist and into the belly. So Abby, if you take a big deep breath in for me now and relax. And you can also try a breath hold. So on the next breath, a big deep breath in and hold it for 3, 2, 1 and let go. Great. So you'll notice that my hands were rising and falling as Abby was taking her deep breath, and that her shoulders were nice and relaxed. And I would advise anything up to, but not more than 5 breaths. More than that, you'll start to fatigue and you may feel a little bit dizzy. And experiment with the breath hold as well. Some people find that that's helpful. Some people find that that's a little bit more difficult. It's worth trying both. So the next part of the active cycle of breathing technique is that Abby would go back to doing her breathing control, which we've already demonstrated. So you'd perhaps have 20-30 seconds of breathing control, Abby, and that would be followed by what we would call a huff, or in technical terms, a forced expiratory technique. So there are 2 different kinds of huffs. You can do a small, long huff, which I'll demonstrate shortly, followed by a big short huff. And the purpose of the huff is to move the phlegm that's further down in your airways to a more central part of your airways so that it's much easier to clear. We'll start with the small long huff. I'll describe it, demonstrate it, and then Abby will do the same. So with a small long huff, you would start with a small to medium breath in, mouth open, throat open, and a forced but not violent breath out. So you will be using your abdominal muscles a little bit, but you'll force the air out almost as if you're misting up a pair of glasses or a mirror, like this. So you'll hear a little bit of force, but I haven't found that too strenuous. Would you like to have a try, Abby? So mouth open, try and keep your throat open, small breath in, off you go. Okay, try one more time, just with a little bit more force. So it needs to be a little bit stronger than that, as if you were going to be able to mist up a mirror. So mouth open, small breath in, lovely, much better. And the small long huff would be followed up by a big short huff or a short sharp cough. What you may notice when you huff is that you will move the secretions, you'll feel a little rattle or a catch, and it may actually then trigger you to do the big short huff or the cough. So finally you'll do a or a and have some tissues handy, because hopefully that will remove your secretions. Abby, do you want to now demonstrate the big short huff? So deep breath in and forced breath out. Fantastic. And so to summarise and demonstrate the active cycle of breathing technique, we'll go through it together now. We'll start with breathing control for about 10 to 12 seconds. Keeping your upper chest as relaxed as possible and your belly just gently rising and falling. Followed by some deep breaths next, Abby. Do anywhere between 3 and 5 deep breaths, whatever feels least tiring and most comfortable. And now back to breathing control, Abby. So more gentle, more relaxed, but still trying to focus your efforts and energy onto the lower part of your chest and relax the upper part of the chest. We're going to prepare to do a couple of huffs now, Abby. If you remember, the small, long huff. Medium-sized breath in, forced but not violent breath out twice. A little bit more force on the next one, Abby. Fantastic. And follow up either with a short, sharp cough or a big, short huff. Great. And finally, back to some breathing control. I hope you found the video helpful, and remember that you'll need some further advice as to the frequency of doing the exercises and how many times a day you should be doing them, and you should get this information from your respiratory physiotherapist. Thank you.